very welcome to this edition of a conversation where we get to talk about, I would like to call it a marriage between the UK government and Uganda. The two are doing great things for the citizens. Some you don't know, some you will get to know, and I hope each one of us can pick something out of it to better their lives. So today, this is our third edition, and the conversation basically is going to rotate around research, science, innovation, and technology, and how these can actually be leveraged to enable Uganda meet its growth and development needs. As always, my co-host, the beautiful British High Commissioner to Uganda, Her Excellency Lisa Chesney. Did I mention your name right?
You always do, Patricia.
I love that. So please take us on.
Well, thank you very much to you, my beautiful co-host, Patricia. Thank you to the Capital FM team as well. I feel very at home here, as you know.
This is your second.
This is my second home. This is my second home. I don't want to go back to the High Commission. Yeah. But thankful for the warm welcome, and thanks very much to your listeners, for their engagement on this. As you said, this is a marriage. I like that. Our marriage is going well. I'm also glad about that. But we focus on UK and Uganda partnerships on growth, and you're absolutely right. Research, technology, innovation is a big part of this. What people might not know, maybe you do, is that for Uganda, research, science, innovation, technology, right at the heart of the country's growth plan. So I saw that by 2040, there's an ambition to have essentially information, communication and technology exports up to 40% of total exports by 2040. So it really matters. And from a UK point of view, it matters too. We're actually the third largest market globally for AI. We knew that. Anyway, it's exciting for us both. It matters. But we need some expert help, I think, to unpack this topic, don't we? It's quite abstract. So we have the following very distinguished individuals with us today. Professor Moffat Nyirenda from the Uganda Virus Research Institute. We have engineer Bainomugisha from the Artificial Intelligence Lab at Makerere University. And we have engineer Maurice Barigye from Nexus Green.
We have an interesting panel, and I know the ambassador has kind of introduced you guys, but for the benefit of the listeners out there, you're going to tell us more about what you do and how things are moving. I'll start with left or right? Right, because we're looking at left. So I'll start with you.
Yeah, thank you, Patricia, Your Excellency, for having me. My name is Engineer Bainomugisha. I'm a professor of computer science and the chair of the Department of Computer Science at Makerere University. We are, currently very active in the AI or artificial intelligence space. And, in simple terms, what AI means is how do we augment the computers with human intelligence? You might wonder why this is, important to you, and why does this matter to you as an individual, as a training institution, a research institution. What we're trying to do is that, through partnerships with like the UK and other countries, we can grow the local capacity to be able to build these technologies. So positioning Uganda as creator or producer of AI technology rather than just a consumer of technology. Just to explain it in with very, very specific examples. If you look at traffic lights on our streets, the classical traffic lights, they use a counter to raise cars. And many times in the Ugandan context, you see police officers on the road trying to augment the intelligence of the traffic lights. But of course, that comes with risks. The traffic officer is exposed to emissions, risk of accidents, and so on. So imagine the ability to enhance the intelligence of traffic lights, see that there are more cars on this side and this road is free. And then you're able to control the traffic light. So that kind of intelligence is what we are looking at. But really, we can look at all the different sectors. If you go to health, given the bottlenecks we have in the healthcare system, in terms of the human resource on other resources available, is it, possible to integrate technology to augment, the capacity, so that instead of a doctor seeing a single patient, can we be able to augment, that capability with technology so that the doctor can actually be able to see more patients? So for an ordinary citizen out there, this means that we can leverage, technology to be able to get access to services much quicker and hopefully at a low cost as well.
Interesting. I think we'll dig into that a little more later on. Yes, Mr. Gentleman, please introduce yourself. And
well, thank you very much for having me. So my name is Moffat Nyirenda. I am a medical doctor, but a specialist in diabetes and hormones. I'm employed by the London School of Hygiene and Tropical Medicine, which is one of the biggest institutions in global health in the UK as well as internationally. I am based here in Uganda. I am director of the MRC unit in Uganda. The MRC is part of the UK government, which funds research in the UK. The UK has units in the UK, several units. These are engines of research and innovation in health. And there are several in the UK, as I said, but there are only 2 units outside the UK. One is here in Uganda, and another one is in the Gambia. So it just basically shows the very strong links in health in terms of bilateral partnerships between the UK government and the Uganda government. So the unit was set up in the 80s at the peak of HIV, when the Ugandan government made an appeal to the international community, and the UK government responded by establishing this engine for research to try and address the challenges of HIV. But obviously things have evolved, and the unit now is involved in several other pieces of research. So we lead research in viruses, research on vaccines, and more recently research on non-communicable diseases, including diabetes. And so it's a unit that's hosted within Uganda Virus Research Institute in Entebbe. But as I said, it's an entity that is funded by the UK government. So I am the director at the unit in Entebbe.
Mm-hmm. We're honored to have you here. Please.
Thank you, Patricia. Thank you, Your Excellency. I'm glad you talked about the marriage between the UK and Uganda, because listening to my co-panelists, and seeing that they are from the research side, from the academic side, I was a little bit pleasantly surprised, because I come from the trenches, as you'd call it. So I always thought, British government actually supports more in the trenches, but it's actually across all the areas, which is quite interesting, Your Excellency. So my name is Maurice Barigye. I'm a telecoms and electrical engineer. I had a British company called Nexus Green in Uganda. Nexus Green is the largest solar company in the country today. The headquarters is in Leicester, in the UK, but has operations around the world. The biggest operation is here in Uganda, but we also have operations in Kenya. And so Nexus Green deals with solar, everything to do with solar. I'll speak specifically about Uganda and the relationship with the British government. Recently, the Uganda government, about 3-4 years ago, up to 2021, the Uganda government obtained a €94 million loan to promote agriculture. So Nexus Green is actually delivering solar powered irrigation solutions, water supply to the entire country. We have 5 offices across the entire country, and we are using a new technology. And when you talk about AI, I see that we're almost going there, because the kind of irrigation that we're doing is about how do you use for example, meager resources of water that you have at a farm to know which part of the garden to be able to irrigate at a particular time, whether it's 6 o'clock in the evening, 6 o'clock in the morning. And so that's something that we're doing across the entire country. We also provide solar solutions for industries, for factories. Very soon we'll be also starting solutions for homes, for domestic use. And Your Excellency, as you may know, At the end of this year, we should be able to open a solar panel manufacturing plant here in Uganda. So that's something that, that strengthens that marriage that you talked about earlier, Patricia. So pleased to be here. Thank you.
Excellent. And I'm coming to see that when you open it. Please give me an invite. I'm trying to
Without
get
a
out and
doubt.
about. Thank you. Well, look, Patricia, you've introduced our illustrious panel and what a panel it is. I want to come back perhaps to start our discussions to health, to the health and medical research side. And Professor, head of our Medical Research Council, as well as fingers in many pies here. You talked about the strength of the UK-Uganda partnership in health. And actually, I'm only 4 months in, but I really feel that. The UK is actually, people might not know this, we're the second largest bilateral partner on health in Uganda. We work very closely with the Ministry of Health. And through that, we've actually seen the expertise and talent, I think that's here in Uganda, but the partnership goes beyond government to government. And as you've highlighted, that research link is really strong. I think somebody told me there's 38 research programs funded by the UK and Uganda. And I hear from UK counterparts how much they learn from that partnership. Now you touched on the unit, didn't you? The unit, the facility here, one of 2 facilities outside the UK. How significant has that been, would you say, in positioning Uganda as a global leader in medical research, and particularly on epidemic and pandemic response?
So thank you very much. I mean, the investment that has gone into the unit has been huge, both in terms of infrastructure, expertise, as well as the amount of training that has been generated. So we have a unit that is the headquarters is in Entebbe, but we have field sites in Masaka, in Chamlira, we have activities in Kampala, and really all over Uganda in terms of the research enterprise. And we have cohorts that we follow. These are huge resource for research. We have the best facilities for clinical trials if we want to test new products, be it ARVs or other new vaccines for Ebola. So we are the ones who are doing those things. The laboratory infrastructure is absolutely massive, the best that we can get. I mean, you walk into our laboratories, it's as good as walking into laboratories in the UK or in the United States. We have the best facilities to characterize viruses. So obviously, you will have heard about COVID, you will have heard about Ebola, you have heard about monkeypox. During COVID, there was Alpha, Delta, Omicron variants. And to be able to know which those variants were, it was the laboratories from the MRC based at UVRI that were doing those characterization. So it's a huge investment, huge infrastructure. We've opened it up so that it's not just within the confines of the unit, but that others, both in terms of training as well as other forms of support in terms of diagnostic, so that others in Uganda can utilize that resource. And it's not only Uganda, because when we talk about COVID, for example, and monkeypox, we're supporting our colleagues in South Sudan. We are supporting institutions in DRC. We are supporting institutions in Burundi because of the infrastructure that we've developed. So it is a massive investment that the British government has made into the unit, and that the added value in terms of enhancing Uganda's preparedness, health security within the context of the region is absolutely huge. And added to that, it's the training component. So if you look at some of the best scientists in Uganda, some of them taking up high profile positions within Makerere, the deans, the current principal, they've all had interaction with the unit. Most of them have actually been have had training within the unit, and we continue to support them in terms of building their careers. So the investment has been huge. We are also venturing into new areas. So, for example, we are one of the few places that at the moment are able to venture into actual vaccine development. So developing vaccines for COVID, developing vaccines for some of these new threats. For example, the chimeric Congo hemorrhagic fever. These are equivalent to Ebola, playing around whether we can develop vaccines for Ebola. So not just about testing products that have already been developed, but developing these vaccines from within the context of Uganda. And we've had a lot of support from the Ugandan government in as far as that's concerned, because as you know, one of the strategies for government is what is called a pathogen economy, how we can turn the science round so that it's not just about a things that are very proximal, but actually trying to enhance economy by through science. So obviously, if you develop vaccines, you will prevent diseases, and therefore people contribute much more to economic development. But if we develop those vaccines ourselves, Uganda will be able to export and sell these vaccines where they are needed, and therefore there will be huge capital in terms of resources coming to Uganda. So our unit is playing its part in as far as that's concerned, obviously stimulated by this investment from the UK. So it's not just about the unit, the core funding, a lot of funding that supports the actual research activities is sought or comes from the UK government through MRC competitive bids, but also through what is now a major funder for research internationally from the UK NIHR, or National Institute for Health Research. Huge grants coming to Uganda, not just to us, but institutions like Makerere, Barara. If you go there to ask them who is funding your research, it's these schemes from the UK, and they are being championed in a way that more and more they want the center of gravity to shift to the south. So there will be professors at Makerere, there will be scientists at Makerere who have titles that reflect like NIHR professor through UK funding. So the investment is huge. We can talk about this forever.
Excited. I really to keep up to date with my acronyms. Use them a lot, don't you?
Yeah.
I think you've really brought to life, I think, a couple of key takeaways there. That idea of keeping ahead of the disease curve, because they evolve, don't they? They change, and how vital research is. I think that comes through really strongly. I love that point about training, because essentially the capacity needs to be built and grown here. I met the very dynamic Vice Chancellor of the Embarara University of Science and Technology that have all sorts of exciting partnerships with the UK. So I think those links will continue to grow. I think the third thing, I really take your point about vaccine development. That's sort of innovation at its best, isn't it? And one of the things that's important to the UK, you talked about shifting things south, and you're absolutely right. So just yesterday, the UK and South Africa were co-hosting a replenishment of the Global Fund. So the Global Fund is something that underpins tackling diseases all over the globe, because actually we think these things need to be done in partnership. And the last point I think that's quite exciting is how you actually advance the economy through science and innovation and tech. You know, if we can make vaccines here, it creates jobs, etc. So lots and lots of food for thought. Was there anything new in that for you, Patricia? I'm learning here.
I think you've said much of it, but one thing that interested me is just it sounded like a sigh of relief to actually know that there's a team that is working so hard, because now Uganda is faced with all sorts of threats, right from COVID. COVID hit us so bad. We didn't know what was coming next. Each other day we were living in fear. But it's good to know that there is a team that is working ahead and just giving us that sense of safety and reassurance. It feels good. And that brings me to the next question. Do you get the sense that Uganda's public health system is getting strong and resilient as a result of this?
Well, I think it is, in part because of all this investment that has gone in part because of the capacity that has been built, both in terms of diagnostics, in terms of detection, and as well as in terms of how the health system respond through management. And we are now in the current wave of Ebola. If you look at how the detection came about, it was much faster than it had been done before. I think the containment has been much better than it was before. Obviously, unfortunately, one death and 8 or so cases. But if you read the news yesterday, the minister was saying those 8 cases are now potentially discharged. It just shows how resilient the system has become. And that there've been no further new cases, in as far as I understand. And therefore, it shows that we are becoming more resilient. So the rate of detection, the facilities to contain and manage have all increased. That's just one example. The government has put in place other measures, for example, in terms of the National Health Adaptation Plan for to address climate change. All those elements are making Uganda more resilient. Some of the research that we've contributed to ourselves, for example, when it comes to how best we can manage chronic conditions. HIV is a chronic condition. Diabetes is a chronic condition. Hypertension and other conditions. They are currently in silos, managed through dedicated programs. You know about HIV. No one else can enter those clinics. We've come up with some research that has tried to dismantle those silos, take up a much more holistic approach, a patient-centered approach. So people are managed under one roof. And that has been seen to be very successful and also much more efficient, saving the much more needed resources. And it was announced just last week. I don't know whether it's from the challenges that are now apparent from the US directive. The government has acted very swiftly to say we will go down the route of integrated care, and that will enhance resilience, and therefore the systems will be better prepared. The challenges will remain. Hospitals will need continuous power supply, so it's good to see that individuals do that, and there will need to be advances to capitalize on AI. We have dire shortage of expertise. We don't have that many experts. We don't have people who are trained in a way that they can manage everything. There is potential to leapfrog the whole process by embracing AI, as engineer was alluding to, not just traffic lights, but also when it comes to health. So there is a lot of potential there to make these systems even more resilient. So my feeling is that, yes, we're getting there. We should be mindful of the challenges that still remain, but they are not unsurmountable.
Mm-hmm. Thank you very much. And if you have just joined us, we are having a conversation around the Uganda-UK partnership. And today we are speaking research, science, innovation, and technology. And yes, we'll go to my friend here, Engineer Bainomugisha. Is that how your name is pronounced?
Correct.
Nice. I like to pronounce people's names in the right way. Yeah. And I'm glad I did that right. So let's talk artificial intelligence here. AI has become a buzzword everywhere. Exactly what is its transformative potential for everyday life? I mean, why should Ugandans even be bothered about artificial intelligence?
Yeah, thank you. As you say, when we say AI, we mean artificial intelligence. And as Ugandans, we need to obviously, pay attention, because the fact is we're already consuming AI in our digital platforms, either the phones or digital platforms that we are using. So it's very important to, get into this space. I think before, a few months ago, before the launch of, the large language models, or things like ChatGPT, I think it was very difficult to explain AI, what AI can do. But with the explosion of the use of, ChatGPT, which is basically the interfaces, computer interfaces that make it easy for people to ask English-like questions or human-like questions, natural language-like questions. I think now most people, when you talk about AI, they actually think about ChatGPT, but actually AI is much broader than that. AI is really about how do we make our digital systems smarter. And for us to be able to do this, there is a process. As a university, one of our core mandates is actually on teaching and training, around AI, education and research. And we started, this field in 2009, actually through collaboration with partners from the UK. In fact, one of our co-founders of the AI Lab, John Quinn, is actually from the UK. He came to the UK soon after completing his PhD, and at that time, even when no one was talking about AI, we actually started building use cases on what AI can do for Uganda. And one of the initial cases we are looking at that time was actually agriculture. You have a farmer who is in the field, and the farmers are faced with, pests and diseases. But sometimes, they are like these unknown kinds of pests or even diseases. And one of the first use cases of AI that we worked on was how do we make it possible for farmers to actually diagnose plant diseases with their phones. And this kind of, demonstrated the capability on what AI can do for a farmer in a rural area, bringing AI technology to the farmer. But now with the explosion of AI, when you take every sector, you can actually see a use case of AI, and partly because of some of the constraints that we work in, as Professor Moffat was saying here. If you go into healthcare, you'll find that there are not enough experts. If you take health facilities, I think one of the things that we've been looking at is also using AI to improve diagnostics. For instance, if you look at the number of experts available, look at microscopes versus the number of patients available, you find that there's a bottleneck there. And one of the things that AI can actually do is that we can train computer models to be able to automatically take a sample of malaria and actually tell you whether there was a malaria incidence or not. So these are the kind of cases that we are looking at. But as a university, our role really is can we be able to build local capacity on creating AI? Two, can also be able to demonstrate what AI can actually do for Uganda. And then the third element of that, of course, is because when you talk about AI, there are inherent risks that come with it. I think when you talk about AI, there are worries about people losing their jobs or getting replaced. The fact is, AI is going to shift some jobs. It's going to create new jobs, but also some jobs are going to go away. So as Uganda, we also need to, really pay attention to this. And some of the things we are doing now through the partnership with the UK, particularly FCDO and IDRC of Canada, is building research teams and training programs on how we can build responsible AI systems. So responsible AI system is that can we be able to build local capacity to build AI that does more good and less harm? So that's essentially what we are, currently focusing on, and what AI is.
I think I like AI for people that are engaging in agriculture to be able to read more or be ahead of, for example, this life of the soil. You just don't want to wake up and plant and then you don't get any yield. So AI should be able to, tell you that, what, in this period, your soil will be dead and then you have to do this. Just, it's nice to work smart. Lisa?
Exactly. It summed it up as ever. It's about working smart, isn't it? It's about adding that extra layer. And I love the fact, engineer, you were talking about that fund, the UK-Canada fund, that's already about sort of expanding AI for development, exactly as you say, Patricia, for low and middle income countries. And it's great to sort of hear how that's practically being put into use. And you're right, this is something I think some of us feel a bit scared about AI. I know I do, if I'm being honest. But I also feel excited at the same time. There's one bit that I wanted to pick your brains on, engineer, and that is, this can feel quite remote, can't it? Science, innovation, technology, and AI. As Patricia said, we want to unleash the potential for a farmer, for someone in the creative industries, for somebody doing business to be even more effective and efficient. How does the voice of that farmer or that trader or that business reach these big discussions that are going on about where AI goes and the research? How do you bring those two bits together?
Yeah, thank you, Your Excellency. Yeah, that's a very good question, actually, in terms of bringing people who actually consume or are affected by AI, or even when you take out AI, these are the people who actually have, the biggest challenges. So how do you actually ensure that they are involved in the creation process? So one of the the things that we do is that through the design and the setup of our innovation programs around AI is actually to ensure that all the key stakeholders are actually involved. So people who use, the end user, the consumers, but also the government in terms of the regulation. So for the case of the farmers, and why this is important is that if you build an AI system outside the country and bring it here and deploy it, it's going to be very difficult for people to actually use the system and trust it. But if people are actually involved in the development of the system, they are likely to adopt it much quicker and also trust it and improve it. So for instance, for the case of the agriculture thing, because when I talk about AI, computers by default, they are not intelligent, and they get their intelligence from the users. So if you go to the a rural part of Uganda, for instance, you actually find that the farmers there have knowledge about certain issues in the agriculture. But the challenge is that sometimes this knowledge is limited to a few people. And we can actually leverage that because we can leverage the expertise of the farmers or even extension workers to train the AI system. Because for the AI system to be able to recognize that this cassava plant is diseased, a farmer or an extension worker has to be given maybe 100 images and annotate the images that have disease incidences. And then we take these images, we now train an AI model. So from the farmer, it gets the intelligence, and now the AI model is actually able to reproduce that. So that's one way to integrate the local or the farmers into the AI development. The other use case, which is quite popular and makes sense for Uganda, as you know, Uganda, we are quite diverse, over 40 different languages across the country. And most of our systems are, usually in English. But actually to build an AI system that can be used by some of these communities, we need to actually make it accessible in their local languages. And it's unlikely that you get an expert outside, Uganda who will actually build an AI system that can be able to understand the local languages. And one of the things we've been doing is working with local communities, people who speak very good Luganda, people who speak very good Risoga. We give them, phrases of, English texts, Someone can translate it in Lusoga, and then someone who actually speaks very good Lusoga can read over or voice over them. And then we use that to build a language model that can understand Lusoga. So these are some of the ways on how we are, engaging the local communities into this. But of course, we do not do this, without also the collaboration, because we know that expertise exists elsewhere, like the UK and the other countries, on language, technology. So we leverage some of these partnerships, for instance, under this, the FCDO and IDRC funding, to leverage expertise. I think expertise is good regardless of where it is, whether it's in the UK or elsewhere. So being able to leverage this expertise that exists elsewhere, and then embedding in the local expertise, and then the local context knowledge that comes from the researchers, but also the ordinary Ugandans, to actually build an AI system that is relevant and usable for our context.
I love that. And I love the idea, as you described, of a farmer, for example, helping make the most of AI or making the AI system more expert. I have to say, I feel that I am less intelligent than my computer. It beats me every time. Maybe the farmers have nailed it. But I think agribusiness is an area, we've talked about this before, haven't we, Patricia? Agriculture is an area of potential.
Yeah, yes, it is. And I like that you're already engaging the people that are meant to benefit this. From where I come from, I've noticed that sensitization is key in every project, any development that comes, and it has to be continuous. You can say, no, we sensitize them at the beginning of it, and then those who took it up, that's good. Those who didn't, it's your loss. It has to be continuous, because this is coming with a lot of challenges as well. People are going to lose jobs, but you have to understand that you're losing here and you're gaining here. So I really think sensitization and encouragement for people to actually be able to adapt and, go with the flow is really crucial. And since we're talking about farmers, I will turn to Maurice here. You're operating in the agriculture space where the majority of Ugandans are employed. Kudos. But how accessible are your solar-powered irrigation services? I mean,
just before I answer that particular question, I was very intrigued by what Engineer Bainomugisha was talking about, because I see a lot of already synergies that can actually happen straight away in what I'm doing. And now to your question, you mentioned, and you're indeed right, because agriculture supports 24-25% of the GDP in this country. And that's the intervention that we're actually doing now. Now, the thing is that Uganda has traditionally had very fertile soils. There have been very good seasons. No wonder a certain British Prime Minister called it the Pearl of Africa, because of, because of how we are. Of course, the problem is that with climate change, farmers do not know when to plant, they don't know when to plow. We used to have defined systems. We used to know that the short rainy season is in March to May, and then the longer one is in September to December. Now you actually do not know. You have lots of rain in August, so you don't know. Now the thing is that the British intervention has actually made accessibility to irrigation systems much easier. Before this particular project that I ran, there were many other interventions. African Development Bank, French agencies, a few NGOs here and there. They would do maybe irrigation interventions, solar powered or sometimes diesel powered at 10 locations. And also many Ugandans we relate to our president, I think just before the elections of 2006, irrigating with the bicycle and the bottle, trying to promote agriculture. And I'm sure you remember that the media also made a tweet about it, calling him Bosco or something like that. So the whole thing was about how do we leverage what we have here and make Uganda the breadbasket of Africa. And that's what the British intervention has done. By injecting this amount of money straight away, it became the largest intervention in the irrigation space. Because you're doing this in the last 3 years, we've done about 600 sites altogether. That's, for comparison, before then, we had done about 50 sites over the previous 5 years, right, as a country. of different sizes. So this particular intervention has ensured that solar powered irrigation systems are actually accessible. Because if you went to the database of the Ministry of Agriculture and the Ministry of Water, where most of these applications from farmers are, you find thousands and thousands of applications from the different parts of the country asking, how can we get help? Because the systems don't come cheaply. So sometimes people go for the cheap diesel systems, but then they are not sustainable because, the cost of fuel. But with solar, you just put it there once and that's it. But of course, it was quite expensive. Now, with this intervention by the British government, these systems are actually given out to communities free on the requirement, on the condition that actually you can actually make these systems for use in the community, and you actually have a change. And so they are very accessible, but also it has introduced fresh challenges because how do you tell a farmer who's been planting beans and maize that you need to stop this because there's no point in irrigating beans and maize, right? There's a couple of more things that you can actually do that can actually promote agricultural productivity. So yes, they're much more accessible because of this intervention and because of what we've done is that encouraging other technology partners from around the world, they brought in cheaper systems. So these systems are actually now very accessible and very available. And the beauty here now with the power of the internet is that people can actually determine what they want to be able to deploy in that regard. So that's what we have, and that stimulus, so to say, is continuing because Uganda, the marriage continues with the British government because I know that the British government is actually trying to support a phase 2 of this particular program, which will support another 700 groups of farmers. These are not just individuals, it's groups of farmers. So you find that in this first phase, for example, you have almost 10,000 households taken care of in this particular instance. And it's not just in irrigation systems, but also in water supply systems, so it's massive and it has brought, services closer to the people, water closer to the people. Yeah.
I think I find it fascinating. So somebody did tell me, Maurice, and maybe you can check this fact.
Yes.
Actually, only 3% of Uganda's arable land is irrigated at the minute. So that means there's a lot of potential, actually, a lot of potential that could be unlocked through climate smart innovations. Yeah,
absolutely. And the thing is that it's amazing what this does. And when you talk about what I have a farmer. A group of farmers in Masaka, right? They had this piece of land where they were trying to do some, carrying water from the traditional irrigation. You'd be carrying water from a well to try and pour the water, sort of hose the water all around the gardens. But we've introduced new technology whereby the technology sort of mimics the rain. You lay pipes and there's in between laser spray. In between sprinkler and drip, it's called laser spray. So you mimic the rain. Now, the productivity of this farmer, believe it or not, it's amazing. Right now, the farmer does 1,000 boxes of tomatoes every season. For context's sake, each box of tomatoes in the market is 350,000. So you can imagine how those, and the fact is that you can actually have 4 seasons in a year because the tomatoes actually grow for 3 months, right? There's another farmer in Mukono who is doing 12 bags of passion fruits per week because of these interventions. And so it just unlocks a lot of potential. And that's why I was talking about the potential collaboration with AI, because now you have all these produce. The farmer sits there and says, okay, what do I do now? Because, he has a lot of market. So he needs to find out what's the best price so that he's not, shortchanged by the middleman. Then he has to think about diseases because he has to talk to people, professors about the diseases of the plants. How do I prevent this? How do I ensure that I get the best market? How do I ensure that I train other farmers? Because these are actually demonstration farms. That's what the UK government has said, and the Uganda government has said these are demonstration farms. So because you cannot serve everyone. So and straight away I'm thinking. Because we do provide agronomy services as well. The whole change you talked about, talking to people, and the whole change about the mindset of saying, okay, look, you need to think about and this is continuous. I mean, you're absolutely right, Patricia. From the beginning, say, look, we're going to take part of your land, we're going to install solar panels, but this, 25 decimal piece of land where you put solar panels, you're not losing it because the production that you're going to get from the remaining part of the land is much more than what you would have gotten before. So how do you teach the farmer? So I'm thinking that, how do you incorporate AI into the agronomy services that we're actually doing in these cases? So yeah, the potential is enormous, and that this project itself, actually, the number we've done the calculations could contribute just the first phase alone. If you do the high value crops, coffee, tomatoes, vegetables, up to 3.6% of the GDP.
I'm going to have to remember these statistics. These are really powerful ones. And you're right, there's lots of pieces in the jigsaw, isn't there? So I'm glad that with Nexus Green, you're able to unleash your potential partly through UK export finance. So we know that that's an important part of the mix.
Yes.
But also those programmatic interventions around building climate change resilience, making a difference to households. I'm hearing that's something that's important for us to continue supporting in partnership with Uganda as well.
100%.
My goodness, I've learned a lot, Patricia. I don't know about you. I mean, how on earth do we sum this up?
Actually, when he was giving his submission, he talked about a gentleman in Mukono who gets 12 bags of passion fruits in a week. And I'm like, what am I doing in the newsroom? You're losing out on money. Exactly. That's good for someone to actually be able to invest. Maybe not so much, but get more, and that gives you the zeal to continue doing what you're doing and to embrace change whenever it comes. Because back in the day, we would definitely wait for the rains. No rains, no foods in the gardens. But now, with innovation and stuff like that, we're able to get fruits like passion fruit like all year round. That's cool, I think. And we're going to talk agri-innovation. And that is exactly where you are, Maurice.
Yeah.
So how big a market opportunity does Uganda promise? And also, briefly, we'll talk about how easy it is to acquire investment finance here.
So I think when we start talking about agribusiness and agri-innovation, we have to think much more than Uganda. Because we have the potential not just to feed Uganda. Because you talked about the fact that, you have tomatoes all year round, you have pineapples all year round.
Yeah.
And people are wondering, how come nowadays you have pineapples all year round? And I can tell you that every morning, right, there's a group of Kenyan trucks that come in. Someone was talking about 50 trucks that cross the border, bringing in carrots, onions, all these onions that you buy in Nakasero market are from Kenya. And what do they ferry back? They ferry back tomatoes, they ferry back avocado, they ferry back pineapples, right? And funny enough, they're clever. They reach them, they say produce of Kenya and export them. That's a whole different conversation we shall have. But the thing is that the market opportunity is enormous, right? Because we're 45 million people. And as Her Excellency mentioned before, you only have 3% of the land being used. So what are all these people going to eat? Even if you start irrigating today, because the target had been to increase the irrigated acreage of Uganda. Right now it stands at about 75,000 hectares. You need to, the country is 256,000 square kilometers. You need to push it to maybe 100,000. And that thing is that it's real that Uganda can become the breadbasket of Africa.
Yeah.
It is possible because I know that we buy gonja from Congo, but they take a lot of our bananas. They take a lot of our, especially fruits and vegetables. So the market opportunity is huge. Now, talking about financing, for the big projects, of course, UK Export Finance is here. UK Export Finance is what is funding these projects. UK Export Finance is funding not only in the agriculture space, they are funding the new airport in Hoima, they are funding the big industrial park in Namamve. So this is British taxpayers' money coming in through the UK Export Finance to be able to do big projects. But even you have smaller projects, under the BII, which is called the British International Investment. So this money is actually accessible. Now, what happens is that when UK Export Finance and these other entities come in, and then of course you have FCDO providing some grants, then you even have a challenge to the local banks and saying, okay, look, there's money here, so we need to change our business models to able to access or support the SMEs and other farmers. So that opens up the market and opens up the market for investment finance, which is what it is. And the thing is that what we have also seen is that the British government, through other instruments like Garantco, provide guarantees to banks, which help the banks able to provide financing at cheaper rates. In areas where they would normally, when you normally go there and they'll ask you for what building do you have. So that collateral can actually be, given by a British investment facility, called Garantco, something like that. So the opportunity is actually there, and they can actually be enhanced, and much more can be done. And I really like the fact that you talked about marriage, because the marriage is in, not just agriculture, it's in roads, it's in dams, it's in, it's in everywhere. Yeah.
And down in Zero is Gaya's side, Luweero side. I used to go there a lot last year, and every time we'd drive through, we'd see trucks, and one day I was just very curious. So I asked, the locals around, said, those people come from Kenya. They've come for pineapples. They only come for pineapples here. And I was like, wow, the market is there. And I think we just need, like I say, mindset change, sensitization. Back then, okay, not so many years back, agriculture had become boring. But now it's interesting, and you'd also notice that so many people have jumped into it because they see that now they can reap from what they sowed. Yeah. In case you've just joined us, we are talking of a marriage between the government and Uganda, and specifically we are talking research, science, innovation, and technology. Lisa, we are running out of time. I would like you to wrap this up. I know we can talk about this marriage all day because it sounds all rosy, so I'll ask you to wrap this up.
Thanks, Patricia. And listen, I would just say, I would cross a border for a Ugandan pineapple. Absolutely. They are sweetest I've ever tasted. So how do I wrap up such a rich discussion? I mean, thank you very much to all of our panelists. Look, I think I've got 3 messages that I'm taking away from what you put on my radar. Certainly how that everything is connected, isn't it? And how science, technology, research, innovation, it's the glue that helps us make the most of these. We have, Professor, you were talking about getting ahead of the disease curve, improving health outcomes, where you need actually sustainable energy for that. When we were talking about beating climate change, needs really smart ways for irrigations to unlock the potential there. And we talked about connection globally, health security is something that we should all care about. So I'm excited about the potential of science, tech, innovation, and research to connect us. I think my second takeaway, an engineer, you sort of helped me understand this. It's about the importance of the local voice, the importance of local capacity when it comes to innovation and development. You can't do these things outside and expect to be able to use them here. They've got to be shaped and informed if they are in the health sector by the expertise that's here. And then the last thing I think on my mind, Patricia, it's something you mentioned, this can be quite scary, particularly the AI dimension. How do you beat climate change? How does a farmer recognize there might be a need to shift in terms of methods? That sensitization, engagement, conversation that underpins sort of change and innovation, I think, is the other thing. And I love the fact that we've highlighted how AI sounds this big thing, research and innovation sound these big things, but they make small but really important changes to people's lives. And I think we're really proud in our marriage, and it's a good marriage. And there are challenges, aren't there, in every marriage, and there are challenges, of course, in unlocking research, innovation, and technology. But it's definitely something we want to keep on working together on.
Yeah, this has been very educative, rich, an interesting conversation. Thank you very much for listening. I'm Osman Patricia. Bye.
Thank you.
Thank you.